Dear friends, hi. This picture shows the Charcot Bouchard microaneurysms here and here, arising from the perforating lenticulostriate arteries, which are very small branches of the middle cerebral artery. These arteries are very small, no larger than 300 micrometers in diameter. What is the clinical significance of these microaneurysms and how they happen? I have a case of a 60-year-old male patient with a background of chronic hypertension and presented with acute onset left-sided weakness, and CT scan was done, and there is an acute intracranial hemorrhage with a small extension in the ventricular system here. Let's scroll the images and let's have a quick look. This is an acute hemorrhage. There is a vasogenic edema, this hypodense halo around. Okay, and now I will show you the images. After 1 hour and 50 minutes, the CT scan was repeated because the patient deteriorated and the GCS was dropped. And this is the second CT scan, which shows significant enlargement and extension of the right-sided parenchymal hemorrhage, with more prominent extension to the ventricular system, as you can see here and there, the fourth ventricle. The right thalamus and the basal ganglia, the mesencephalon and the pons have been involved, as you can see. The right-sided brain edema is more profound, and there is effacement of the sulci of the right brain hemisphere comparing to the left. Okay, you can see effacement of the sulci due to the edema. And there is also a new midline shift towards the left side, which was not apparent in the previous CT scan. So all this progress in just less than 2 hours. Now I will show you the CT angiogram of the head, which was performed, and we will see a very interesting finding. This is the CT angiogram of the head. Let's set the right window settings. So this is the hemorrhage, and let's have a look just here in this region. I will scroll the images up and down. Okay. So what is this finding here? They are two isolated IV contrast blush-like spots at this area, which is between the right thalamus and the basal ganglia, which are not in continuation to any other vessel, and these findings are highly suggestive of the source of the active bleed. Actually, this is the source of the active bleed. And the most possible diagnosis in cases like this is a rupture of microaneurysms of the perforating arteries, the Charcot Bouchard aneurysms. So let's have a look again. The main cause of these microaneurysms in the lenticulostriate arteries is the chronic hypertension, high blood pressure. And as you know, high blood pressure creates stress along the walls of the blood vessels, which promotes atherosclerosis and increases smooth muscle cell proliferation, and consequently this makes the blood pressure rise even more and worsens the stress of the blood vessel wall, which can cause microaneurysms like this. And if the aneurysm ruptures, it results in bleeding and formation of this large intracranial hemorrhage we saw previously. Let's have a look again to our findings. This is a really very interesting case. It's worth to note that I searched very carefully all the intracranial arteries and I didn't find any aneurysm, any large aneurysm or any AVM, arteriovenous malformation. And given the history and this finding here, the arterial blush, a rupture of Charcot Bouchard aneurysm is the most possible diagnosis. Dear friends, thank you for watching this interesting video. If you like my videos, you can consider to subscribe to my channel, so you will be notified the next time I will upload a new video to my channel. See you next time soon.